There we go. It's there.
Hello, my name is Antoinette Roy, and I have Emily here and also Jordan and Shakayla, all my group members. We're presenting on the role of the school nurse. And we all chose this for several different reasons. One reason we wanted to explore the role was because this is the actual role in community health nursing, and also because you get to have summers off. Of course. And I'll go ahead and pass it on. Go to confusion. Oh, that was my slide, but- Okay. What about this part? Okay. Some of the primary roles for nurses, the professional role of the school nurse is more focusing on education versus most nursing roles which focus on health. The school nurse wants to try to keep students in the classroom, and their job is expanding, especially since after the 1975 Public Health Act that required that children with mental disabilities and physical disabilities be mainstreamed into the public populations in the schools. So school nurses, they have to be familiar with lots of different medical protocols and technologies such as the glucose pumps. They have to do trach care. They have to have individualized health plans available. Some nurses even have to follow laws as far as do not resuscitate orders for some of these children.
All right, I'm going to talk about the scope of practice, and as Antoinette mentioned before, the school nurse deals mostly with the children in the classroom, and in addition to that, she will deal with the parents, she will deal with school personnel, she will also deal with corresponding with the school board, as well as physicians. So in her scope of practice, it depends on, in my research, it depends on what state she's in, what city, what the laws and regulations are for that state, just like any other nursing laws. It depends on where you are geographically, because things may change. For some places, because there are a larger population of students, the nurses ratio I read would be 1 to 750 students. And that's just, again, that's a larger population versus an elementary school where you may have 300 to 400 students. But I recently worked with one of my patients in home health that attended a school that had a school nurse, and she covered the entire school. And that's just because of the area that we're in, Duval County, because of budget and different restrictions, she may just deal with a certain amount of students. Pretty much she serves as a liaison between the school, as I said before, the community, parents, the physicians, and then that goes along with, let's see, the disciplines that she interacts with. A lot of school nurses sometimes have to deal with social workers because you have certain students that are in foster care that have special needs and disabilities. So she deals with a broad range of people. And again, because I was a home health nurse in an elementary school, I had to communicate with that school nurse on behalf of my patient. So she kind of builds a bridge when you come to her being in a school environment, because she is serving the community, she's serving the students, she's serving the parents, and she's also corresponding with the physicians and the school board to which she is hired. So that's it for my portion. I'm going to turn it over to Emily.
Okay, the question I'm going to answer is what educational preparation or training is required to function in the role of school nurse? For education, that really depends on the state also, same as her topic. For Florida, the minimum education is associate's degree in nursing, but they do prefer a bachelor's degree in nursing. The National Association of School Nurses recommends that the minimum degree be a bachelor's degree in nursing. The years of experience for a school nurse, the minimum is 2 years of acute care nursing experience, but again, that also differs and is specific to the employer. A registered nurse license in the state is what is required. So if you're working in Florida, of course you would need the license there. There are different certifications depending on where you work. main certification needed is a basic life support for healthcare professionals. Pediatric Advanced Life Support, or PALS, is another certification that some employers require, but not always, although it's always preferred. The National Certification for School Nurse, which is the NCSN, is also required for some positions. This is just a breakdown to summarize what is really needed versus preferred. Of course, the RN degree, associate's degree in nursing is what's required, but many places prefer the bachelor's degree, and of course, we'd love to have the master's degree. Okay, these are just some professional organizations that are specific to the school nurse: the National Association of School Nurses, the Florida Association of School Nurses, and the Florida School Health Association. All of those are organizations that the school nurses can join.
Okay, some necessary skills and abilities that are required for a school nurse are that she needs to be able to work independently. Sometimes you're by yourself or there's only one other nurse, so you need to be able to act independently and be very organized to care for sometimes very many students. As Shakayla said, there can be hundreds, maybe even thousands of students that the nurses are caring for. They need to be a good educator, as they may be the only point of contact for health education that the students may be able to access for their health conditions. And then they just need to have good communications with adults, like with parents and teachers, and with children. Some clinical skills: basic first aid, obviously some education in pharmacology. Psychiatric nurse experience can be good, just for dealing with students that are going through a trauma or things like that, and crisis, and then therapeutic communication. And then I'm also going to talk about some interesting topics regarding the school nurse. They are in a critical role when it comes to the health well-being of the children, because they may be the first people who see signs of abuse or chronic health conditions such as asthma or scoliosis when they do health screenings at schools. And then they're also in a unique position to provide education that can really change a student's life that's dealing with chronic conditions like asthma or diabetes. And I thought it was interesting just how low the pay is for school nurses when they have such a big responsibility and role with our children.
Alright, so we discussed the role of the school nurse, and overall the school nurse, her job is to safeguard the health of students and even co-workers in emergency situations. And also, sometimes the school nurse, she's able to reduce the calls to 911 if she has that individualized health plan for a student. So if a student has a severe anaphylactic reaction, she can give them the EpiPen, and sometimes students may be able to go straight back to the classroom, or in normal cases after an EpiPen they would have to go to the ER, but they would be stable, and chances of mortality are greatly reduced. And that concludes this